next guest is Linda Reinstein. She's the CEO and founder of the Asbestos Disease Awareness Organization, ADAO. She was happily married with a daughter and life was pretty good, and then her husband got mesothelioma. Linda then took on the cause of banning asbestos not only in the USA, but globally. ADAO is about much more than banning asbestos. They are a round-the-clock organization committed to 3 initiatives: education, advocacy, and community. Please welcome Linda Reinstein.
Thank you for the introduction, Claire. Dr. Cameron, I appreciate the invitation to come back and speak for a 4th time. It's an honor to join you all today. Clicker is, yeah? Good enough. I want to talk about the human cost of inaction because I think after an afternoon of hearing about all these wonderful clinical trials and what's happening in the medical field, it's also important to know some of the things that aren't spoken about, not necessarily in this room, but when you read articles and you look at studies to see what is exactly going on behind the curtain. Most importantly, though, before I begin, I always dedicate every keynote presentation to a victim, but today is different. I'm going to dedicate it to 3 victims who paid the ultimate price for a hug from a parent. It was a deadly hug. Michael on the top left lost his battle at 29, Janelle on the right at 39, and Debbie at 54. Again, staggering. And as Dr. Irving Zelikow said it best, statistics are people with the tears wiped away. And for all of the doctors who treat the patients, and all of you here today, you know exactly what that means. So I had the unfortunate distinction of learning about mesothelioma the hard way. I want to tell you a little bit about my story, not for sympathy, but so you can better understand my work today. In 2003, after 9 months of symptoms, my husband was finally diagnosed with pleural mesothelioma. And at that time, I'd never heard of the disease, I couldn't pronounce it, and soon found out it was incurable. Like most Americans, I also thought asbestos had been banned. I was grief-stricken. I sit in the garage, in a dark garage on a brown box, crying to regain my strength to go back inside to take care of my husband and my then 10-year-old daughter. Fueled by my intense grief and anger, I had to do something or mesothelioma would claim my life too. I turned my anger into action, and I co-founded the Asbestos Disease Awareness Organization in 2004. And like Claire said, we maintain our principles of education, advocacy, and community. And I think in light of the previous excellent discussion about big business, it's important for me to tell you that we do not make legal referrals. So what is the human cost of inaction? How can we really describe what goes on? I'm going to touch on all 4 of these points: human, financial, environmental, and of course, the weak policy that condones excessive use. So the WHO tells us that every year, 107,000 people die from asbestos-related diseases, and that's primarily a workers' statistic. 55 other countries around the world have banned asbestos, but unfortunately, Canada and the US have not. So taking a look at this graphic, it is so strong. On the left, you'll see an ad from the early, late 70s. And it says, when life depends on it, use asbestos. And they knew. They knew over 100 years ago that asbestos was linked to diseases. And on the right, you can see the catastrophic disaster, not only the 9/11 disaster, but you can see the plume of smoke, of dust, with asbestos and many other chemicals there as well. So during the course of the last 115 years, we've consumed 31 million tons of asbestos. So where is it? Your house? Your car? Your children's school? Where is that killer chemical now in your life? I want to take a look at consumption because that's really important so you can understand the previous slide a little bit more readily. So in the 1900s, we knew that asbestos was linked to disease, and there were papers that were already being written. You can see the consumption. I'm going to go through 4 different aspects of this slide, but you can see how it looks like it peaks out, and then of course it drops down to nearly nothing. Well, that's also deceiving. So in the early 1900s, the first block of time that I want to look at, these first 40 years, we knew in 1906 that asbestos was actually linked to asbestosis. And Nellie, poor Nellie, she paid the ultimate price for working in a textile plant, her life. Now we saw the unions start to organize and things began to move in the late 1930s. And then from 1940 to 70, I think things started to change for the better, and I'm sure that Dr. Cameron knows all of this and can nod along. We had 3 significant doctors write papers, do studies, Doctors Dole, Wagner, and Selikoff. And it was fascinating to see their research, not only with the worker, but what happened when the worker went home. What was that take-home exposure like? The deadly hugs that claimed Michael, Janelle, and Debbie's life. Moving forward, you can see consumption was still high, and it peaked in about 1973. And at those high levels of consumption, it's actually staggering to think that 803,000 tons of asbestos was consumed during 1 year. Now, Steve McQueen, his widow, helps us with ADAO, Barbara McQueen. She buried her husband in 1980. Mr. Tough Guy. It was a staggering thing for a poor 27-year-old wife to look at her husband, who was so talented, dying from a disease that he couldn't pronounce either. As asbestos consumption began to lessen, Congressman Bruce Vento died in 2000. Now, from this graph, you might think, well, Linda, why do you go to Congress and work so hard to ban asbestos and foster research? Well, the reality is, in 2003, Warren Zevon died, and again you can see the low levels of asbestos, or what appears to be the low level of asbestos. Well, the last mine closed in California in 2002. What were we thinking with over 100 years of knowledge that asbestos was linked to disease? And we in California continue to mine asbestos. It's unconscionable. It's criminal. So during the period of time on the graphs where you saw it look like it flatlined, it was anything but flatlining. During this period of time from 2000 to 13, we consumed over 55,000 tons of asbestos. Now, it's so simple, or at least to me it feels simple, especially as a mesothelioma widow, that the only way to end this is through prevention and a cure. And our organization is very proud to stand on the front line for both of those. So if you look at NIOSH data, the National Institute of Occupational Safety and Health, I guess I'm sort of a mesothelioma nerd at times because I like to do research so that I can better articulate this problem to Congress. But in this 10-year period, from 2000 to 2010, 43,464 Americans died of only 2 of the asbestos-caused diseases, mesothelioma and asbestosis. You saw a photograph of my husband a little bit earlier. My daughter was just 13 when she saw her father take his last breath. Alan is represented in that number. And like Selikoff said, we're more than just a number. So what does that mean today because of our heavy consumption during that 115-year period? Well, NIOSH tells us that the firefighters in a 3-cohort study in San Francisco, Chicago, and Philadelphia, they've identified in the study as quoted, the firefighters in the study had a rate of mesothelioma 2 times greater than the rate of the U.S. population as a whole. And I think after looking at the 9/11 picture, you can understand. In fact, I just had a hard-hitting meeting with the Firefighters Union in D.C. just last week, so we're working on more collaborative efforts. This came last week. I usually have, if you look at my slides in the syllabus, they're never the same because there's so much new information. And just this last week, the WHO Europe, into quotes, says at least 1 in 3 Europeans can be exposed to asbestos at work or in the environment. And what does that really mean? The EU banned asbestos years ago, and they're still suffering from exposure. And we, the United States, haven't done anything. We have a reduction, but we don't have a ban. I thought this was another very interesting WHO study, and they actually calculated the cases during a year time from just 15 of the European countries. That number is over $1.5 billion spent on cost of medicine and treatment for just 15 countries, 1 year. Can you only imagine what that cost looks like in the United States? But there's another cost. Yes, there's lives. Yes, there's medicine. But there's also environmental cleanup, as I was talking earlier about the human cost of inaction. There's an environmental cost that we have to pay. And who is the we? Everyone sitting here. Federally, we have spent through EPA $541 million to clean up Libby, Montana. At a lovely little town that I visited where they mined vermiculite that was contaminated with asbestos. And that town is so toxic, the asbestos is actually within the trees. So when they burn the trees, the asbestos can actually become airborne. So when I'm working with members of Congress, I'm always trying to identify new ways that I could create my oral argument to drive action. So we looked at this 1984 EPA study, and I thought, well, let's do this again. It's about 30 years since we've done it. And you can look at these numbers of how many buildings have actually been contaminated. Back 30 years ago, they said over 100,000 primary and secondary schools were contaminated, and over 700,000 public and commercial buildings. How many homes? How many other buildings? This example, I think, highlights what happened in Huntington Beach. I live in Manhattan Beach, so I was called down in October, and the parents were sobbing. They were sobbing. There was a HERA violation, and these children, the staff, and the parents were exposed to asbestos. And what happened? The school didn't take action, and ultimately, I worked with the teachers in the union. They were so strong and wonderful. 1,600 students were finally displaced. They were sent to another school, and it cost the school district over $600,000. That's an early number because I know legally it's going to cost them far more. So what does ADAO do about it? We blend knowledge, advocacy, and community together. The penny slide at the top, I don't have a pointer, or maybe there is one here, but under President Lincoln's nose, you can see 20,000 asbestos fibers compared to human hair and grains of rice. I made this slide up so members of Congress could understand that you can't see, touch, taste, or smell this fiber. How are you going to reduce exposure? And every year we pass resolutions and we work on stories. We work very hard to connect the dots. We're so proud this year, for the 11th time, the Senate unanimously passed the resolution that I draft and submit. It actually calls for the Surgeon General to issue a warning, and this year he did a warning again, urging Americans to beware of asbestos. But what's happening now? Not enough. I just came home a day ago from Washington. There's actually a bill in Washington that's being pushed by the chemical industry, and it won't even ban asbestos. Asbestos isn't even named in the bill. So I'm going to ask Claire and Dr. Cameron to allow you to learn more and to share social action so you can actually help us to get this bill fixed before it's signed into law. In March, I had a fun phone call. I got a phone call that said, "Is this Linda Reinstein?" I'm saying, "Yes." "Well, this is Senator Boxer." And I thought it was a robocall because it was the local election. Well, it wasn't. She called to tell me that she wanted to name her TSCA reform bill after Alan and Trevor Schaefer, who had brain cancer. So she did. She introduced it. She signed it in front of my now 22-year-old daughter. We have a copy of the bill, but we want more. We want components of that legislation of Barbara Boxer and Ed Markey's bill to be put into the bill that doesn't even name asbestos. So we have to take it to the streets. Education. ADAO started a new educational campaign that says, "Hear asbestos, think prevention." We want everyone in this room to go home and to encourage one person to understand that asbestos, a man-made material, could be in their homes, could be in their schools, and let them know about prevention. Come to our website, learn more how to protect yourself and your community, because for now, prevention is the only cure. So watch for this graphic to come across after the conference, because I'm going to ask, with Claire's help, and Bob is always so great to work with us, to have you get involved. I want to hear from all of you to raise your voice, to make a difference, and to be heard. Because one life lost to an asbestos-caused disease is tragic. Hundreds of thousands of lives lost is unconscionable. And as I remind Congress, each time that I testify, I say without responsibility, accountability, and transparency, no one is safe. They look at me. They sit up straight. They know the truth. Something needs to be done in Washington to protect all of us today and our future tomorrow. Thank you for giving me the time.